Hello, welcome to the clinic. I hear that you are here today due to a sore on your face that hasn't healed in several months. I want to thank you for coming in today. This is part of a preventative measure and will help us figure out what's going on and diagnose and get to the bottom of the cause. So today I want to talk to you about skin cancer and just some things that we can do to help prevent skin cancer and just the different types of skin cancer and the best ways to treat it. So starting off, skin cancer is most commonly found in people that have light skin and spend a lot of time out in the sun. So skin cancer can occur anywhere on the body, but it is most commonly found on places that are exposed to the sun more often, such as your hands, your face, your neck, and your arms. So skin cancer does normally occur in adults, but it may also occur in children or adolescents. So the most common sign of skin cancer is a change on the skin, such as a growth or a sore that will not heal. So it is important to do a self-check regularly. So a self-check is part of a preventative measure. And so, for example, a self-check would be after you're out in the sun for a long period of time to just check your skin and see if there are any new bumps or sores or places that you haven't seen before. And if there is a bump or something that just looks a little funky, then you could call your doctor or make an appointment with a dermatologist just to come in and get it checked, just to make sure that nothing is happening. So skin cancer may also appear as a red flat spot. It could be rough or scaly, and sometimes it could be red or reddish brown. So if you see anything like that, I advise you calling your doctor and making an appointment or going to see your dermatologist. So preventative measures are important because that is you taking steps to making sure that you are less likely to get skin cancer. So one of the main preventative steps is to make sure that you put on sunscreen when you are outside for long periods of time. So sunscreen should be applied every 2 hours if you're outside for long periods of time, except for if you are like at the pool or a water park. It is important that you apply sunscreen more often since water is involved in your activity. So another part of sun protection could be wearing a hat. That will help sun stay off your face and help protect your face from skin cancer. Also, sunglasses are important because they do protect your eyes. And if you're outside for long periods of time gardening or doing something with animals, it is important that you wear a long sleeve shirt or long pants to help protect you from the sun. So there are 4 main types of skin cancers that we're going to talk about today. The first one is melanoma, and melanoma is a tumor of melanin-forming cells, and it is associated with skin cancer. And it's a malignant type of cancer, which means that it's very aggressive. So it's important that you catch it on quickly so that you can take the steps to preventing it. Squamous cell carcinoma is another type of skin cancer, and it arises from the epidermis. So squamous cell carcinoma usually appears as a red elevation with scales. So it grows rather slowly, but in some cases towards the end, in the later stages, it might start to spread throughout your body. So it's important that you identify it and start the steps to getting it treated. So another type of carcinoma is basal cell carcinoma, and so it also rises from the epidermis, but it will most likely only spread when it goes untreated. So if you treat your basal cell carcinoma, you are more likely not going to have any other problems with it in the future. So the last main type of skin cancer is Kaposi's sarcoma. Kaposi's sarcoma starts on the feet, and it's known by the formation of purple or brown patches. So if you start seeing purple or brown patches, then you should call your doctor or dermatologist to come in for an appointment. So treatment of these cancers differentiate depending on the type and the severity of the cancer. And so there are 3 types of ways you can remove the cancer, and these are biopsy, debridement, and dermabrasion. And so each of those will remove the skin or the dead tissue in a different way. And so there are 2 types of grafts that can be used, and one is dermoautoplasty, and that is the graft that uses the patient's own skin. And then there's also dermatoheteroplasty, which is a graft using a different source of skin other than the patient's. So these are the different ways that you can treat skin cancer if you happen to develop it. So all the things that we've talked about today are very important in being preventative with skin cancer and knowing about it so that you're able to do self-checks and know when you may need to call a doctor or dermatologist and come in for a check. Thank you.